Hello, everyone. My name is Devin Odell, and today we are going to be discussing my In the Expanse of HIV Tennessee program. Our mission is to empower these individuals with knowledge, courage, and hope to continue their HIV care and remain undetectable. All right, so let's get started. A large amount of Tennesseans are currently living with HIV and struggle to retain their care because they require frequent residential changes. Um, this makes them lose access to their providers, whether that be because of not knowing how to do their record changes or just not finding the new provider when they move. Yeah. So we can implement this program through things like mobile health clinics, pop-up sites for testing and treatment, and our digital marketing campaigns like our Instagram posts and TikToks. Um, these can address any disparities between gaps in care. All right, so keeping these individuals um, connected to their treatment will reduce overall HIV transmission and create much more positive health outcomes for this specific target population, even if they are still remaining extremely mobile when it comes to their residents. So, our target audiences will be, first of all, individuals ages 18 to 25 who are currently living in the urban areas of Nashville. So, these highly populated areas. Um, these individuals are, for our program, frequent residential relocators who are already diagnosed with and receiving treatment for their HIV currently. So this population, statistically 18 to 25 young individuals, they are known to have the highest rates of risky sexual behaviors. So the reason for them being the target is obviously because they are much more known to not use condoms or contraceptives of any kind to prevent any kind of STIs. Continuing our target audience, this young adult demographic, as I said, is known for their increased rates of STIs, sexually transmitted infections, and unwanted pregnancy at younger ages. Again, this is due to not using condoms or contraceptives of any kind. At this younger age, people are just less aware and know what they're supposed to be doing, I guess. Um, by targeting this specific community, we can reduce sexually transmitted infectious diseases rates and limit the amount of individuals who are losing access to their care for these STIs and HIV. And secondary, our secondary population would be healthcare providers on college campuses who will be providing these free treatment options or any kind of continuity of care packages. They will be giving them out to this demographic. So, all right, so now we're going to get started on our cost benefit analysis. Our first population that we are going to look at is individuals with HIV and who also have frequent residential mobility. So as you can see by the little icons, the costs are on the left side. So some costs for this group would be they have to be able to pay for their care and to find some stable housing. So that is going to be a large financial responsibility that they have to take on. And they have to be able to support themselves to continue their own care and treatment. They have to be able to get to those appointments and financially, of course, support through that as well. But the benefits would be, of course, finding more stable housing, which will give them peace with being able to get their consistent care and have a stable household to live in and continue to receive the treatment that they need. Next on our cost benefit analysis is the young adults ages 18 to 25 in urban areas. Again, the costs are on the left. As you can see, for this group, it would be they have to ensure they can get consistent access to their care. So they have to remember to attend their appointments and testing. It as a commitment to make sure you're doing so. So the benefits though of this would be overall healthier sexual practices, which is just good for any sexually active individual. This will lead to less STI infection rates, as well as unwanted pregnancies. So it overall would take another burden off of this group between getting rid of their STIs or unwanted pregnancy. So, and then our last population on the cost benefit analysis will be the healthcare professionals on college campuses. For their costs, they definitely would have to devote a lot more time and energy of their workday towards getting testing methods and prevention methods. Um, so this would be taking time out of their already maybe busy schedule doing their work to put some more focus on this. But the benefits would be overall better healthiness on their college campuses, as well as better sexual health for all these college age students. So this is going to again take a big burden off of the group if they're able to provide good treatment options or prevention methods. Next, we are going to go to our communication and marketing objectives. First is the social media outreach objective. So our goal with our social media is to increase involvement with HIV testing, HIV testing centers for these individuals that are ages 18 to 25 in urban Tennessee counties. We can do this by promoting local HIV testing locations. We can have personal interviews on our Instagram that is individuals describing how they were able to remain consistent with their care regardless of if they had to move. So then our outreach and equipping target population objective. For this one, basically, we're going to identify a number of individuals who are already living with HIV and provide them with some tools and resources that will help them remain connected to consistent healthcare, even if they have to have some kind of transition of their medical providers. So again, for this one, we could use mobile health clinics and treatment programming. So basically just giving them options of how to work through any kind of medical transition that they may have. So continuing our objectives, we have the printed materials objective. For this one, basically we're going to distribute a large amount of educational materials to local health departments and educational institutions in the surrounding urban areas. These will highlight any of the frequent, any of the links between frequent change of residents and frequent change of HIV care providers. So we can again give them any kind of transferring care materials. So then we are going to look at our virtual and digital health outreach. So for this one, we're going to host a number of Zoom events that will target these individuals already living with HIV and or healthcare providers who would like to get involved and take up a part of the cause. So for this, we're going to have, of course, our digital health materials like our posters, and we'll have those printed as well. This we can use app creation apps, appointment creation apps. Basically, you can do this online so you don't have to call or go in person. It makes it much easier for these individuals. Again, then we'll have medical record transfer options as well. So here I'm going to take a moment to speak about my focus group. So I conducted a survey with a small group of individuals that basically asked them about several aspects of my objectives as well as printed materials, asking for feedback of if they fully provided what needed to be provided and if they looked pleasant and adequate to the viewers. So from this, I changed just some like orientation and aesthetics of things. One of my major points from this one was to use less professional language and try to make it a bit more personal. So since this program is targeted towards younger adults. Trying to make it sound more personal towards them is definitely a large goal. So then I also adjusted to ensure all my target populations were met and that I also accounted for some major stakeholders in terms of my objectives. So, yeah. All right, so here you can see to the right, there's some of my prepared marketing materials. These are going to be posted and distributed to some educational institutions throughout Nashville and any surrounding highly populated communities. So here is some examples of our social media materials. These are what we will be posting to our Instagram once the program begins. Basically, just highlighting a lot of ways to stay in connection to your care and team up with people. Get together and make sure you guys all get tested and stay tested and treated and all the things. All right, so wrapping up, in conclusion, this program is entirely integral to individuals, young individuals who are sexually active and in these highly populated urban areas. Individuals are going to go their whole life being sexually active, and they need to make sure they know all the steps of how to protect themselves against STIs and HIV. Furthermore, the funding of this program can not only reduce HIV and STI rates, but just improve the overall healthiness of this young demographic. So, thank you guys so much for watching.